Welcome to the Health Deli, your local stop for a fresh take on community health topics. Come on in, grab a number, and let the guys behind the counter, Mark, Ben, and Mike, tell you about today's specials.
Hello, everyone. Thank you for joining us for another fantastic episode of The Health Deli. If you couldn't tell already, I am Ben, and I am joined with some friends at the absolutely fantastic Health Deli Studios here at Fair State University. I am joined with the always lovely Mark Young.
Thank you, Ben. Thank you. It's nice to be here, getting the team back together, the whole gang. It's nice.
Yeah,
it really is.
It's nice. It's nice. And then also the lovely Michael Klepser.
I haven't decided if I'm actually here or not. Give me some time.
Just going to mentally check out halfway through.
Checking in about 5 minutes. I'll let you know if I'm actually here.
All right. After the Health Deli, we'll see if you're still present or not. Or the Healthy Minute. That's the one. That's the one. We also have Andrew and MJ rocking the tech.
Hello.
Hi there.
Hey, it's pleasure having you. I do not have a special word to torture you both with about, if you can pronounce things in healthcare.
Thank you.
You're welcome. You're welcome. This is a nice, lovely episode. We're all going to be friendly with each other.
Pretty much I'm out.
Yep, that's why Mike is going to be gone after 5 minutes. But anyway, the episode today is actually a follow-up episode based off a recommendation that you had, Mike. And so previously we talked about seasonal allergies and what they were and that kind of stuff. And then you brought up, can we talk about allergy shots? So allergy shots are a kind of treatment that we can use. Sometimes people refer to them as essentially vaccines for allergies. And so what are those? How exactly do they work? And who is recommended to get them? Those are kind of the things that we plan on covering today. Is that everything you were hoping we'd talk about, Mike?
Yeah, I wasn't listening. Sorry.
Okay. Well, then, yes, I'm doing a perfect job, I think.
Yeah, I know very little about allergy shots other than I've heard of people getting them. So I'm interested in this episode because I do have allergies. So,
Well, and again, this is because I wasn't listening. Are you going to talk about oral immunotherapies?
I'm not going to talk about oral immunotherapies. I'm going to purely talk about the injectable ones. But maybe that'll be a part 3 episode that we can have later.
Or if you could just do a good job the first time, we could have wrapped this up 10 minutes ago.
Well, you should have known when
the second time, but whatever.
Yeah, true. Third time's the charm, right? But before we get into that, do either of you have anything you're working on you want to spoil the people?
Yeah, I'm working on an embarrassing bodily function episode. I think it's going to be a fun episode. Maybe not a lot of science involved, but just kind of explaining those embarrassing involuntary bodily functions.
Yeah, and I know Mike is very excited for that one.
He is, I'm sure.
No.
I'm also working on a men's health episode, so.
Okay. Are we going to talk about my prostate again?
I would love to.
You want me to show it to you?
Mike's prostate corner coming back.
No, thanks.
Anyway, Mike, are you working on anything other than your prostate?
Actually working on the questions from seniors, episode. So hopefully we'll get that rolled out quickly. So that'll be the big one. And then I got a whole lot of things. So I'm going to just drop this on you. I counted the other day and we have done over 55 episodes.
Wow, that's amazing, actually.
Yeah, I can't believe we still have something to talk about.
Yeah. And
we're going to be rolling into season 4 sooner rather than later. So, yeah, I got a whole bunch of nonsense cooking.
We're going to have a season 4 special, a 50-episode special that's
we'll
8 episodes late.
We'll figure something out. You guys might not be invited. It might just be me.
We'll bring back some old guests, That'd be kind of
We
fun.
also need to update the photo of you guys. Mike's getting older every minute.
Yeah, you look at him, a picture of him and look at him now. Completely different person.
Yeah.
It's the Barack Obama effect.
True. Just all that stress, from day to day working with us.
Yeah. Oh, tell me about it.
True.
For sure.
All right.
But that sounds great. We'll definitely have to follow up with that later. But yeah, so today's actual episode is going to be about kind of a follow-up to the allergy episode, talking specifically about that allergy kind of immunotherapy, those allergy shots that people may or may not have heard of. Before we talk about that in general, though, I want to just give a brief review of what we talked about last time to kind of set the stage for the kind of more in-depth topic. So you may remember during the previous episode, we talked about allergies. In essence, an allergen, or something that causes allergies, so that's what an allergen is something that our body recognizes as not being us. So our body likes ourself, right? Our own cells, but it doesn't really like other things. It tries to fight those things off because those things could be viruses, they could be bacteria, they could be all sorts of.
Mike.
It could be Mike. You
He's
definitely
an allergen.
Again,
true.
I'm out.
And so our body doesn't like those things. And so whenever that is inside of our body, so let's say a virus is inside of our body, our white,
Let's say a virus is inside of our body.
there is probably a virus inside of our body right now.
Well, you told me, you said, let's say that. So I did.
Oh,
Just following instructions.
I thought you were being clever, but no, not this
And
time.
you make fun of my.
Do you guys want me to be out again?
Yeah, please.
No comment.
Is there a way we could shut off Mike's mic?
Mike's Mike. Anyway,
Mute Mike.
so
Mute Mike's mic.
our body, let's go back to that. Our body is trying to fight off whatever it is that's inside of us that it doesn't like. And that's going to cause all the symptoms of allergies. So that's going to cause us to potentially sneeze. It's going to cause us to have a stuffy nose. It might cause us to have a fever. So we're trying to get rid of all of that excess stuff.
So it's not necessarily the virus. It's more of our immune response is what gives us kind of those symptoms.
Exactly. Yeah. And so usually if it's a virus we're talking about, we want these things to happen, right? We don't want a virus inside of our body. We want to sneeze and get it out of there. The fever will hopefully help increase the temperature in our body to help kill the virus a little bit better. But what if it's something that's not actually damaging to our body? So what about if it's just pollen? So pollen isn't part of us, but it's not actually going to harm us in any way. If it's kind of just hanging out there, it's just chilling in our body. And so that's when you have essentially seasonal allergies. So these things that aren't necessarily harmful to us, but they get into our body and cause our body to start trying to fight them off and kill those things, which causes all these symptoms. That make sense?
I think it does. It does. It's kind of like that old curmudgeon like Mike on his lawn.
Okay, I'm
just
back.
at,
What?
Yelling at every kid that walks by, just get off my lawn.
Were you camping out at my house yesterday? I mean, it's
I was, and you're
exactly
yelling.
what I love to do.
Get off my lawn.
I think I saw a video about it on TikTok. Everyone was having a grand time with it.
Yeah.
So yeah, that's essentially what allergies are and what allergens are. So now that we have that baseline in place, we're going to dig into the weeds because we need to have that understanding to know how these allergy shots actually work.
Before we get next to weeds, I'm going to take my allergy shots.
Okay, perfect. So we'll give you a couple of months so that way they fully start working.
Ooh, nice.
Which we'll talk about that a little bit more in the future. But so before we talk about the allergy shots, we need to talk about in depth of our immune system. And so I'm sure Mike and Mark and potentially MJ, maybe Andrew as well, knows that we have different kinds of white blood cells.
Andrew didn't know that.
I didn't know that.
Okay.
Nope.
But
Told
I
you.
also don't have allergies.
I know him well.
Wow.
But he's really interested in colorectal screening.
I am now.
We're making that episode happen, I guess. So we have these different white blood cells, and the ones that we care about right now are called B cells. So we have B cells, we have T cells, we have all sorts of other things. So our B cells, essentially, when they see something that isn't a part of our body, and this is a very complicated process, but I'm going to kind of make it very straightforward and simplistic.
Mark thanks you for that.
I do.
So our B cells see these kind of allergens, and they make what's called antibodies. And so antibodies are essentially specific to one thing. So let's say pollen, and it kind of attaches to the pollen and acts like a flag. And then that flag tells the rest of your body, this is something that I want to destroy. I don't like this thing, so get rid of it. And so that's what our B cells are doing. Does that kind of make sense?
Mm-hmm. I need people antibodies.
Yeah, I'm making that sign right now on this piece of paper.
He's making his own antibody.
$1 million T-shirt idea.
I love it. I love that. So yeah, the antibodies act as a flag, and then our body attacks that thing that we see as we don't like. Now, to get it a little more complicated, there are several different kinds of antibodies out there. We're going to talk just about two. There are more than two. We're going to talk about IgE antibodies and IgG antibodies. So I'm just going to call them E and G to make it a little bit easier. Okay. So E antibodies, so the first ones that we're talking about, they work by attaching to a different kind of white blood cell in our body called a mast cell. And these mast cells have a bunch of histamine in them. Histamine is what causes allergies, causes us to sneeze.
Because you talked before about antihistamines.
I did.
Is being used to treat. See, I actually paid attention to that one. And so
That's impressive.
Obviously these histamines then must be important for allergies.
Yeah, makes a lot of sense, right? And so they attach to the mast cells, which have histamine inside of them. And that essentially is like kind of a mine just waiting to go off. So the antibody.
How about a piñata?
A piñata is a good one too. So it's essentially a piñata. And so it's just waiting until it sees whatever it is that antibody is specific for. So let's just keep talking about pollen. So you have this mast cell with an E antibody on it. And then when pollen comes along, it attaches to it and then it just releases histamine.
So the pollen becomes like the stick that you hit the piñata with.
Essentially. Yeah. I like this analogy. Or is that a metaphor? I think it's both. I like it a lot though.
A metaphorical analogy.
I can't get past pinata. I want some candy, and so I'm waiting for this to play out.
That's fair. I wish I would have brought candy. Unfortunately, what we're talking about is histamine, which is a lot less fun.
Man.
All right, I'm back out.
Okay, fair enough. Okay, so that's normally what's happening. So you expose to pollen, and then this E antibody causes the mast cell to release histamine, and that causes your allergies, which we don't like. There's a different kind of antibody, the G antibody, which works in a different way and causes a different kind of immunity, essentially. I'm not going to get deep into the weeds of how the G antibodies work. Just know that they are different and they are not as much involved with the mast cells and the histamines and that kind of stuff. Does that make enough sense?
I think so.
Okay. So now let's imagine that you're a person, right? And you have
imagine Mark's a person. This is tough. I mean,
This is going to be a stretch.
Look at that. We all got that.
That's true. That's true. I can't.
All right, I'm just imagining. Okay, I am a person.
Okay, thank you.
Inconceivable.
That's what I needed.
Okay.
So your body has identified that pollen is a threat, and it's going to make the E antibodies and the G antibodies to that pollen. The E antibody is binding to that mast cell, ready to release pollen as soon as release histamine as soon as it sees pollen. And then the G antibody is also around, but it doesn't have an immediate effect. So it's not causing that histamine to go off. So when you're exposed to pollen, the first thing that happens is the E antibody binds to the pollen, releases the histamine, and the G antibody doesn't really get a chance to have an effect right away. So that one has more of a delayed effect later. Okay. So that is really what you need to know to understand allergy shots. Now, how do they actually work is the next question.
So maybe you're going to get into this. Do they work? Maybe. And how do they work?
Yes.
Okay.
Yes. So I'm going to definitely talk about both of them.
Good.
I want to keep the good stuff. Do they actually work or not until the end?
I like that.
Yeah.
I like that.
Okay. Lead you on a little bit at first.
It's all in the pinata still.
Exactly. So allergy shots, which are also sometimes referred to as allergy immunotherapy, they essentially change the way your body responds to the allergens. So normally we have the IgE, and that's kind of running the show, but the allergy shots change that. So the way that you actually get an allergy shot, right, you need to go to an allergist, so someone who's an expert in this, and they kind of walk you through this process. So the first thing they do is they identify what are the allergens, what are the things that you're allergic to. So they're going to do a bunch of skin tests. They're probably going to do it all down your arm or down your back and see what it is that causes you to have a reaction. So that's the first thing that's going to happen. They're then going to make kind of a special blend of allergen that's kind of all mixed together just in this like liquid. And that's going to be your allergy shots. Next, you get injected with this blend, which exposes your body to just a very small amount of the allergen. And you're going to get these shots every few days, and then every few weeks, and then finally you'll get it every month. So essentially you're kind of slowly introducing more and more of this allergen to your body until your body's kind of gotten used to it. So that's the process of how it works.
So is the amount, so you're saying you get it every few days first, and then every few weeks, and then every month. Is the amount you're getting very small off the bat, and then they like increase the volume, or is the volume kind of the same?
Yeah, good question. And so I may have misspoke. From my understanding, it is the same amount every time.
Okay.
So the first shot you get will be the same shot you get a year down the line.
So
essentially,
you kind of get a lot because you're getting it every day, and then they kind of wean you off it.
Right.
A little, but not all the way off. You still get them every month.
Essentially, right. So you get relatively a lot of exposure. Again, it's still a very small amount for the first couple of days because it all builds on top of each other, and then you go to monthly.
Gotcha.
Yep.
Okay.
At that point in time. So why do we do it that? Why is it done that way? What does that actually do in our body, essentially, is the next question. So the way that this works is this constant low-level exposure to the allergen causes your body to make more G antibody than E antibody. So the E antibody is the one that's causing all the histamine release, while the G antibody is not. So the G antibody that you now have a lot more of in your body is going to bind to the allergen before the E antibody can.
Oh.
And so it kind of binds up all of those receptors that the antibodies normally can bind to. So that way the E antibody comes in and it just has nothing to bind to anymore.
So the G antibody sounds like a parent who doesn't want their kids to keep hitting the piñata.
So it's essentially you, Mike.
And kind of,
Grabbing the stick while
grabbing the
they're swinging at
stick, yeah.
True.
Party pooper.
Wow. This metaphor has gone a lot farther than I thought it was going
It's
to.
the only thing I got for this episode, man. Piñatas.
Hey, I appreciate it. We like piñatas. So that's essentially how it's working. So the E antibody can't bind to it. The mast cell doesn't go off and doesn't release all that histamine, and essentially makes it so you have less, or maybe not at all, an allergic response to the things you used to be allergic to. Yeah. So that's the theory. Does it actually work or not? So
that was my question.
yeah.
Clinically, does it work?
Yeah. So before I tell all of you, I want you all to tell me what you think. Have you heard anything about these? Do you think that they're going to work? MJ, Andrew, I'm going to look at you two both first because you don't have any as much medical training as we do. What do you think? Do you think that these actually work or not?
I would hope it works if they're doing it.
That's fair.
I think that if I think about how the thought process about how I'm sorry, I wasn't prepared to actually answer this question.
That's okay.
But I was thinking just about like what the effect of a allergy shot actually is intended to do, and it makes sense that it would like fill in code or things that would make it easier for you not to be imbibing those allergens into your body. So yeah, it seems to me like they would work.
Yeah. Theoretically, it's a sound theory, right? If everything I just said was correct, which hopefully it is, it would make sense that it works. Unfortunately, in medicine, that doesn't necessarily mean it really will work.
I've got people who swear by them. I got them. I think they're just a load of crap.
Okay, so you've had them before, Mike?
Yes.
They weren't effective? Okay.
And I'm going to say, for maybe one time ever, I actually agree with Mike that I know some people that swear by them. I know some people that had used them for a long time and quit and not noticed the difference. I've seen people the opposite, where they weren't on them and then they, for whatever reason, quit doing it and they had terrible allergies. So yeah, I don't know. It's kind of all over the place.
Okay. Yeah. And I think that's perfectly ties into this study that I'm going to very briefly walk us through. So there are several studies looking at allergy shots and whether they work or not. And, that is what I care about, right? Like I care less on what's actually recommended. That is important. Don't get me wrong. But I want to see the actual data. Do these things work or not? So this study that we're going to very briefly talk about is by Durham and colleagues, and it was done in 1991. Which is kind of wild to me because I didn't realize that allergy shots as an idea were like,
You mean way back in the 1900s?
yeah, can you believe that?
Oh yeah, they're a long time.
Yeah.
It has the basis for homeopathy as well.
Oh, interesting. Okay, cool. And so back in 1999, this was one of the first studies done on this. There were a couple done before it. But essentially, this was a randomized, double-blind, placebo-controlled trial. So hearing that, what are both of your thoughts? Is that good?
Sounds
is that
good.
bad?
It sounds like a good study design for something like this.
Yeah, usually we think that that's kind of like our gold standard. These are the studies we want to do. So far, so good. A total of 47 patients were in the study.
Not very many patients, considering how many millions of presumably people have allergies, and you can only find 47.
Well, in the fact, deviation here. Allergies are broad. You might say, I'm allergic to pollen. What type of pollen? Is it tree? Is it flower? What species? So a whole lot of things. And the other thing is, one of the more profound things I ever heard in my life is people with allergies tend to have allergic reactions. So
Really?
Yeah. And so they're more prone to have allergies to other things. And
You're talking about like medication allergies?
I'm talking about everything. So if you have allergies to pollens and stuff like that, you may be more likely to have other types of allergies. And so, being very specific with an allergy shot always to me just seems like kind of stupid.
That's fair. Well, that's why they test you ahead of time to hopefully help a little bit with that.
I think they just do that to make your back swell up.
They want to torture you.
Yes.
No. Okay, so yes, the study design itself seemed pretty solid, but it was only 47 patients, so not a whole lot of them. And then they divided those 47 patients into 3 different groups. Okay. The first group never has been on allergy shots ever. Okay. And they continue to not have allergy shots. They were just getting placebo the entire time. And placebo just being essentially nothing. So like a water shot. The second group had been on allergy shots for a year prior to the study. So they'd been on allergy shots for a year, and they were continued on their allergy shots. And then the final group had been on allergy shots for a year before the study, and then were changed to placebo. And so essentially they had the allergy shots before, and now we're going to be getting water shots. So not actually getting that allergy cocktail.
Sure.
So that, as you're thinking about that, that further divides our pretty small number of patients, right?
Right now
Normally
you're
we
down to
have two
what,
groups.
15-ish
Right.
per
group.
arm? Yeah.
So very small number of patients. And so who wants to guess what happened here? What do you think? Do you think it was effective? Do you think one group did better than the others? Any
Well,
thoughts?
so again, when you have that few patients, how do you tell? How do you tell if there's a difference? Ben, this is back to your season 1 stuff. There can be variability, and you're never really going to detect a difference. Even if you find a difference, it might not be statistically significant.
Yeah.
I'm going to say 30% of those people who have never been on allergy shots, but were only given placebo, actually noticed a benefit.
I think the placebo actually did better.
Really?
Yeah.
Wow. Okay. Well, we will find the answer to that question after the Healthy Minute.
I love the suspense. Let's pause for the Healthy Minute, brought to you by the winery at Young Farms. Today's Healthy Minute is exposure to loud noises can injure your hearing. Exposure to loud noises, whether from work environments, concerts, or everyday activities, can cause permanent hearing damage over time. Using hearing protection such as earplugs or earmuffs helps to prevent noise-induced hearing loss and ensures that we maintain our hearing health as we age. Even everyday activities like using power tools, attending sporting events, mowing the yard, or listening to loud music can contribute to hearing loss if proper precautions aren't taken. Incorporating hearing protection into these activities is a simple and effective way to preserve your hearing. By taking proactive steps to protect our ears from excessive noise, we safeguard our ability to enjoy conversations, music, and the myriad of sounds that enrich our lives. Let's prioritize our hearing health and make hearing protection a regular part of our routines. Listen safely and take care of your ears. That was the Healthy Minute, brought to you by the winery at Young Farms in Mecosta, Michigan. Please visit www.thewineryatyoungfarms.com for more information. Now, back to the Health Deli.
Boom, chicka, boom, healthy, 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 healthy.
That was a great one, Mark. But do you have any helpful tips to actually do that?
So
To protect your hearing?
Yeah, I mean,
Use hearing protection.
I know, but in practice, okay, like let's say I'm running out to my shop to use a saw or something, and that's
Yeah.
going to make a loud noise. What should
we-
I do
we
to make
actually-
that actually easier?
So we could actually probably make an episode because I did a decent amount of research on this, and it's not necessarily the decibel level, so how loud the noise is, or how long the noise is. It's a combination. So if it's very loud, but for a very short time, it can cause hearing loss, but maybe not. Or if it's loud, but for a long time, that can also cause hearing loss. So,
And
there's
what
not
about
like
something
a-
like noise canceling headphones or white noise machines
Yeah.
that generate a constant? Maybe that's why I'm deaf, because my wife bought one of those white noise machines.
Yeah, I mean, I have actually incorporated this into my life, and every loud piece of machine, and I have a lot of loud pieces of machinery on the farm. I have hearing protection specifically for each machine. So I don't have I don't have one pair of hearing protection. I probably have like 6. So it's always right there, so I can put it on.
Yeah, and one thing
conscious
I've
of it.
done, because I'm a big concert goer, so I go to a lot of concerts, I bought some high fidelity earplugs. So that way, anyway, I go there, you can put those in, hopefully protect your hearing, but still hear the music, because obviously very loud at concerts. Those things are very expensive, though. I think it's like $30 for a pair of
This
those.
sounds like an episode.
It does.
I read
That would be great.
I read a quote from Ted Nugent years ago, who's an avid hunter, and he wanted to preserve his hearing for hunting purposes, but he's a rocker, right?
Yeah.
So he's always exposed to loud noises. So he started wearing earplugs. And they asked him, why didn't you just turn it down? And he said, that's not an option.
I love it. He's a real one over there. Anyway, Great Healthy Minute. I think that's a great topic because again, big fan of keeping my hearing as well. All right. So back to the study, though. Everyone's favorite, my favorite at least. So as a reminder, 3 groups. 2 of them had allergy shots for a year, one of which they stopped the allergy shots, one of which they continued them. And then 1 group did not ever have allergy shots. So that is who we are comparing right now. So when they compared the 2 groups who had been on allergy shots before, and then they stopped one and continued the other, there was no difference between those 2 groups in terms of allergy reporting. So allergy scores, allergy symptoms. So those 2 were the same. But when they compared the people who got allergy shots for a year and then either stopped them or continued them, and then compared them to the ones that did not ever get allergy shots, there was a decrease in allergy scores for the people who had been on allergy shots. So it appeared that the allergy shots worked based off of this data. Again, it's not perfect data. And it also appeared that there was this lasting protective effect where as long as you got them at some point in the past, so this year in the past, even though we stopped them, you had less allergies than somebody who had never been on them in the first place.
And, that's not unusual, because our immune system has a memory, to it. And that's the whole premise behind immunizations.
Yeah.
So, okay.
Yeah, it makes sense. Again, there are more studies out there. This one was relatively small. I just thought that was a pretty cool thing that they showed, the lasting effect of it. So there are some higher quality things.
You might not have the study. You don't have the study in front of you. But was there a perceived difference in the placebo group?
The pure placebo group?
Yeah, I mean, you always see that.
Right. I do not know that off the top of my head, unfortunately, but that is interesting.
Unless the patients were allergic to the placebo.
They're allergic to water.
Well, it would have to be saline. You can't inject just sterile water. It hurts like the dickens.
True. So in order to add a little more credence to this, because again, I agree that this study isn't the highest quality one, I pulled up a Cochrane review. I don't know if we've talked about Cochrane reviews before.
I don't believe we have.
I don't think so either.
Yeah. So at the very least, we've talked about meta-analyses. So meta-analyses are when you combine lots of different studies together and you try to use the results of all of those studies together to make a definitive, or hopefully at least more definitive, answer about a question.
Wait, kind of like Voltron, where a lot of the little robots join together to make a big robot that's
like
even better.
Transformers? I like it.
No, that's not Transformers. Just shut up if you don't know what's going on.
Power Rangers.
No, still not the same damn thing.
It's similar.
No, it's
Lion
Voltron. You know Voltron, right?
Lion bots.
Yeah. Oh my gosh, Voltron.
But yes, it's very similar. It's very similar to Voltron in particular, where we're combining all these different studies together. And so a Cochrane...
To create a super study.
To create a super study, a meta-analysis. You're right.
All right.
A super Zord. Is that what they
now
call
I'm
them?
now I'm paying attention. Don't even try. Just go super study, and that's cool.
Got it. Okay. So Cochrane reviews are essentially widely regarded as very good. They're very good meta-analyses produced by incredibly smart people who do a good job at making sure all the studies are appropriate to be combined. So usually a Cochrane review, if there's one of those on a topic, you really want to consider that. Okay. It's very high quality information. So they collected a total of 51 different studies. We're not going to talk about all of them, obviously. And what they found overall were that allergy shots, so this allergy immunotherapy, was effective for seasonal allergies. So overall, people who got allergy shots had a decrease in their allergy score and also a decrease in the amount of anti-allergy medications that they were using. So it appeared to be pretty effective.
Why didn't they measure the amount of Kleenex that they use?
Maybe they did.
They weighed it.
I was just going to say they could have weighed it.
That could have been a weight analysis.
Weighted analysis. Wow. So that's a study joke for all you people at home who did it. Yeah.
I didn't get it.
That was we won't have time to explain it. But the other thing that I think is important is, are these allergy shots safe, right? They appear to be effective, but I don't care they're effective if they're like killing people, right? So that's the other thing that I want to know about. So there has been definitely some injection site reactions where people feel some pain afterwards. But according to this Cochrane review, it was a very, very, very low risk. They did not have that many berries. That was me ad-libbing it. But a very low risk of severe side effects. They calculated it being 0.13% of cases. Wow. So less than 1% of cases had severe side effects to this. That's not saying mild things. So yes, definitely can have some injection pain and stuff like that. But appears to be pretty well tolerated. And they have identified no long-term side effects of using these allergy shots, which again is something I was thinking about, because if it has this lasting efficacy effect, is there a lasting side effect kind of thing going on too? And it seems that the answer is no, based off of their information.
So we touched on pain a little bit. Are these sub-Q IM? I have no idea.
So they're usually intramuscular injections.
Okay, so there is probably a little pain associated. Okay.
Yep. And so not to be written off, but if you can tolerate it, and it's not an extreme amount of pain, right? It's a relatively minimal amount of pain. They can be effective.
Yeah, and it's only once a month once you get into it.
Right.
Now, what about, and maybe you didn't look into this, because obviously allergy shots are not the only tool in our bag to combat seasonal allergies. Mm-hmm. Were there any studies that compared allergy shots versus, just doing, inhaled steroids or your antihistamines, whatever?
Yeah, that's a great question. I didn't specifically look at those. My guess is those studies do exist. As I mentioned, this is a pretty well documented disease state and management of that disease state. And so I'm guessing that exists. I didn't look at it.
But what you're thinking of here is, at least with the antihistamines, it's almost, unless you're taking them year round to try to prevent it from occurring, then you're treating symptoms. Mm-hmm. And so you've already got the allergies to begin with, then you're taking the medications, which they themselves have side effects, drowsy, sedating, and stuff like that. So you're just chasing your tail.
Yep. I think that's a piece of it. And another piece of it for me is it's a lot lower maintenance to get a monthly shot for some people, right? Different people have different preferences. And so I think the convenience factor is pretty big here too, where instead of having to take an antihistamine every single day, which I might forget sometimes and that kind of stuff, if I go to my clinic once a month, and once you get set on these, it's probably just a couple minutes to have this visit, right? They just come in, you get your shot, and then you leave. For some people, that might be more convenient too. Mm-hmm. And I think that's a big part of why people like these kinds of managements.
Yeah. Mm-hmm. It'd be interesting to look at too, and I'm sure you didn't look at this. I don't know why you.
Why do you lead with that all the time? Do you think he does absolutely no work whatsoever?
No, every time he says
your
that,
question's that bizarre.
It is that bizarre. I wonder if you could look at how many people use allergy shots versus how many people are buying medications for seasonal allergies. I feel like there's a relatively small percentage of people that have allergies, that get allergy shots. I mean, I know they're expensive. I know it's a shot. I know all of those kind of barriers. But
so I agree with you. They're definitely not perfect. I've only known one person, and this was an ex-girlfriend of mine, who was taking allergy shots. And a big issue that she experienced was she was in pharmacy school, right? Mm-hmm. And so are you able to once a month go in and get an allergy shot? That might be kind of difficult, especially when you're building up front, where it's like, okay, every 3 days you need to go into the clinic, where it's like, well, no, I need to be at work, or I need to do XYZ other thing. And so if you're not able to consistently be doing that and getting these shots, you actually will have to start over after a while. So if you miss like 2 or 3 months of shots, all right, well, we got to start you at level 1.
This sounds like a great Andrew question. Mm-hmm. Andrew, can you Google this, see how many people get allergy shots? If there's any number on the internet to see just really how many people actually do get allergy shots. And then we can come back to him when he gets that.
Yeah.
Okay. Yeah. And so good question. We can definitely look into it. So the last thing that I wanted to kind of cover today was just, are these things actually recommended? Mm-hmm. And so it's one thing that they're effective, one thing that they're safe, but are people recommended to receive these by, our different organizations that kind of guide our management of things? So the American Academy of Family Physicians, they state that for patients who have seasonal allergies, that allergy immunotherapy or allergy shots are safe, they're effective, and they can potentially result in alterations of people's body's reaction to allergens after 3 to 5 years of therapy.
So what?
Yeah.
I got to take these for 3 to 5 years before I get an effect?
So good question, Mike. That is not what I was saying there.
Oh.
And so they're saying that if you essentially, after a couple of weeks of receiving these, you should start seeing effects. But if you receive them for 3 to 5 years and then you stop, you might permanently have a decreased response to these
Okay.
allergens, is essentially what they're saying.
All right.
So are there guidelines that like suggest that, or is this kind of a once you head down this path, you're going to be getting these for every month
Yep. So there
for the
are
next 200 years if you're Mike?
until the end of time.
Infinity.
So the
Oh, wait. I think they got an answer.
ooh, okay.
I don't know if this fully answers the question. It's a tough one. This is the AI overview, just to be frank with you. According
interesting.
to a 2014 Reuters article, 36% of 8,790 patients chose to start allergen immunotherapy, with about 75% of those patients choosing allergy shots. So we'd have to run the math.
Okay, but still, so some sort of immunotherapy, about 38% of a population. So
No,
that's
okay.
that's a
More-
significant.
Yeah, that's more than what I would guessed. I would have
Yeah.
said 30%. I actually
Somewhere
would have
around
guessed. I actually would have guessed more like 5 or 10%.
Yeah,
would
that's
have
what I would
thought
think
it
too.
was much smaller.
Yeah.
It's
Think,
always 30%, right, Mark?
Right. That's right.
it's always a good
I had
fallback.
allergy shots.
Do you? But you said you didn't think they worked very
I don't think they worked well.
Interesting. But yeah, so there are guidelines, Mark, to answer your question. The American Academy of Family Physicians has a allergy immunotherapy guideline. And so that's available to the public. So anyone can pull that up if they would like. Might be a little difficult for someone who's not in medicine to parse because it's a lot of technical language, but that is available out there. But again, my understanding of it is that once you start on these, the recommendation is just to continue them for really life, unless you decide you want to stop them, with the caveat that if you do stop them after 3 to 5 years, you may have a permanent decrease in your allergies. But
Let me tell you, as somebody who did take the shots, yeah, everybody wants to stop them.
Yeah.
Nobody wants to be on these for life. And so at least giving them an endpoint of, stick with it for at least 3 to 5 years to get optimal benefit.
It might improve it. It might improve initiation rates
Right.
because yeah, a lot of people are like, oh, if I got to take it forever, I'm not even going to start.
Right.
Yeah.
yep, for sure. For sure. All right.
Are they expensive? Do we have time for that
Ooh,
question?
so I do not know the answer to that question. So the problem with that is there's not really a commercial product available for this, right? Like a drug manufacturer isn't making allergy shots. Usually the allergy shots are made at the allergist's office because they're custom made for the patient, right? Depending on what you're allergic to, that's what's going to be in the shot. And so how expensive these are is going to depend on which clinic you go to, how much they decide that they need to charge to provide the service. So yeah, I do not have those
How many
numbers off
things
the top
you're
of my
probably
head.
allergic to?
Yeah, probably.
I'm going to pull up a little pine needle, pull up a little cat dander.
Yeah, they just have a back room with a bunch of cats and pine trees.
So according to a website on the Cleveland Clinic, the cost of allergy shots is usually between $1,000 to $4,000 per year.
Per year.
Price varies between allergists, medical facilities, and health insurance coverage.
Not as much as I thought. Honestly, I would have thought it was more like $1,000 a month. or
Why don't you just give me $4,000 every year and I'll just come over and
It's a
throw
lot-
antigens at
It's
you?
a lot of money, but I was thinking more like $1,000 a month or something. But
And my guess is that that's probably the patient out of pocket cost would be my guess.
Well, that's going to be kind of what the charge is.
Right.
And they said that the price varies based on insurance coverage. And so, yeah,
Right.
it's probably the out-of-pocket cost.
Yep. But it does sound like insurance companies do see value in these and are providing some kind of coverage for them. Who knows how much, but probably depends on the actual insurance agency.
sure.
Indeed. Well, I think that is everything I wanted to say about allergy shots. Hopefully I answered all of your questions, Mike. I know you
No,
said
it's-
you wanted oral immunotherapy, which I didn't talk
Well,
about at all.
and so I looked at this. Well, I was not paying attention to you. I looked at some of the oral immunotherapies as well, and it's a similar premise to the allergy shots. But a lot of the oral immunotherapies are specifically looking at food allergens, like nut allergies. And there is a product that's FDA approved for the management of peanut and walnut allergies.
Interesting.
So, and again, it does show some, effectiveness, but it's the exact same premise, but just no shot.
Gotcha. Okay. So still just building up the different kinds of
Yeah.
antibodies. Gotcha.
Yeah.
All right. Awesome. Well, thank you for looking into that, Mike.
Yeah, definitely.
the
It's
extra info.
definitely nothing to sneeze at.
Yeah, I got to go blow my nose.
Fantastic. Well, thank you everybody for listening to this episode of the Health Deli and listening to these horrible jokes from Mark and Mike.
I think I developed a rash.
Thanks for stopping by the Health Deli to sample some of our wares. We're open 24/7 on Facebook and Twitter at The Health Deli, or visit thehealthdeli.com to send us a question or find any of our locations. Please come again. We will be regularly stocking the shelves with fresh content and new wellness specials. As always, we want to give a special thank you to Andrew Tingley and the crew at Ferris State University's Television and Digital Media Production Program. Until next time, so long from the Health Deli, where the topics are tasty, the takes are fresh, and the discussion is free.
Turn that into a permanent sound effect.
I think I developed a rash. I was gonna think of a joke about how this Health Deli thing has been my allergy shots for Mark and Ben. And I started with a lot of exposure to them, and honestly, it hasn't helped. I still get nauseous every time I come in the room. Nauseous. Yeah, it's just getting worse and worse.
That's fair.
You guys maybe are more like a toxin than an antigen.
I'm toxoplasmosis, I think.
No, you guys are more like mercury or radiation. Yeah, my hair's falling out, and it's because of you.